the board of the Public Health Museum. And as you just heard, this presentation will be recorded this evening. We are on meeting mode, so I'm asking if everyone will please make sure that their microphones are muted so that we don't get background noise. And we'll have a Q&A session at the end, but you can put your questions into the chat at any time and if it's a question that maybe requires some clarification during the presentation, we'll signal the speakers. I'm very pleased this evening to introduce this special program, Why Fluoridation is Good for Public Health. And we have two public health dental professionals here this evening who have the same last name because they're related to each other, father and daughter. And they're going to be talking about fluoride in drinking water. And that has been the most successful population-based intervention in oral health in history. And I think the timing is good to find out why that is. Our speakers tonight are Dr. David Leader, who is Director of Dental Practice and Operations at the North Shore Community Health Center in Gloucester. He and also adjunct faculty at Tufts University School of Dental Medicine. He's a graduate of Emory University and the Tufts University School of Dental Medicine, and is fairly recently the lead author of the Massachusetts Oral Health Guidelines for Pregnancy and Early Childhood for the Massachusetts Department of Public Health. Allison Leader is a registered dental hygienist and the graduate of Forsyth School of Dental Hygiene and the Public Health Program of the Massachusetts College of Pharmacy and Health Sciences. And they're particular individually and as a team, particularly good for tonight's topic. And I want to, on behalf of the Public Health Museum, I want to thank them for joining us this evening and turn it over to them.
Thank you, Al and Amber and Amy. And I hope it doesn't get too confusing since I refer to my daughter also as Al. Today we're going to be talking about the safety and economics of community water fluoridation. Let's see, I just need to shrink that. So, Allison, I think we've already been introduced, so why don't we skip this slide and
Sure
we'll go
can.
right on to slide number 3, which is your slide.
Yes. So, just to briefly review a few objectives for what we'd like you to learn as attendees to our talk this evening. First, a brief history of water fluoridation in the United States, the safety of community water fluoridation, the economics of fluoridation, where we're really seeing that return on investment in this infrastructure, the economics of dental care, now, and the access to dental care. Why can it be so hard to make an appointment, especially in a community health centers like the one my father works in, for example? And how does fluoridation affect access to dental care? What will happen to the demand and the level of access once water fluoridation stops? Let's see, now, as previously mentioned, water fluoridation has been a pretty hot topic in the news recently. Here's just a few headlines that we've cited as examples of that. So, we said community water fluoridation has been heralded as one of the 10 great public health achievements of of the 20th century. However, no, in recent history, Robert F. Kennedy Jr. says that Trump's going to seek to remove fluoride from the drinking water. Uh, Following that, Utah became the first state to completely ban fluoride in the public drinking water. And now Florida is attempting to follow suit, with one of their top health officials urging to put an end to their community water fluoridation. However, even in these states where some of the higher ups are trying to remove the programs completely, the local level government is still trying to keep these great programs in place, such as the Miami-Dade mayor has vetoed the plan to remove fluoride from their drinking water within the state of Florida. So, just a brief little history on dentistry and prevention within oral health as a whole. So, going all the way back to 1844, in the American Journal of Dental Science, uh, an editorial stated that the hygiene of the teeth is almost wholly neglected. And this sort of marked that beginning of the emphasis on dental hygiene and putting emphasis into prevention rather than just treatment. Now, early on, dental hygiene instruction placed the responsibility entirely on the patient. And nowadays, we know it's a lot more complicated than just the individual's responsibility. In May of 1884, Dr. Rain, a dentist from New York City, published an article encouraging other dentists to teach their patients how to properly brush their teeth. And, in my day-to-day practice as a hygienist, this is something I still do with my patients regularly. You'd be surprised how many people learn the basic child method and going forward didn't realize there's more of a technique to it as your needs change as an adult. And then in 1900, Dr. D.D. Smith presented a dozen exhibitions of his patients to show off the efficacy of his new innovative system of dental prophylaxis. Now, dental prophylaxis is what the average person would know today as their regular dental cleaning. And now the introduction of this system is what really laid the groundwork for oral hygiene as a new prevention-focused subspecialty of dentistry, which, turned into the dental hygienists such as myself that you know and love today. Let's see. So with fluoridation, what we're very concerned about preventing is caries, what the layperson would know as cavities, dental decay. Uh, According to the Bangkok Declaration, there is no health without oral health. Unfortunately, your mouth is connected to the rest of your body. Uh, Caries is the most common disease of childhood. It causes infection, pain, it affects school and work attendance, and in very bad situations can even lead to death. And you might notice the citation for this line is someone who is helping me give this talk right now. Now, untreated dental caries, the tooth decay in permanent teeth occurs in 2.3 billion people. And in more than 530 million children, they suffer from untreated dental caries of their primary teeth, their baby teeth. Now, it's important that we recognize that adequate intake of fluoride plays a very important role in the development of healthy teeth and in the prevention of dental caries. And we need to also recognize the need to mitigate the adverse effects of too much fluoride in water sources in the development of teeth. Now, childhood caries is also associated with poorer general health and a faster rate of aging by the midlife.
I guess it's my turn now. I just want to point out that you need not take notes on this. We'll have my email address at the end. Anyone who would like a copy of these slides, you're welcome to email me. I'm happy to email the slides. And you have Allison's and my permission to use our slides any way you see fit. And the second to last slide is a thorough bibliography of everything that we're covering, all of these citations. So let's talk about the safety of community water fluoridation. Community water fluoridation, which by the way is different from fluoride that is in all groundwater everywhere to some extent, is recognized as safe and effective by the American Dental Association, the American Medical Association, the American College of Obstetrics and Gynecology, the American Association of Pediatric Dentistry, the American College of Pediatricians or Pediatrics. I'm sorry, Cousin Myron. I can't remember which that is. The American Dental Hygiene Association, and most other organizations of health professionals. Community water fluoridation at 0.7 parts per million was recognized as safe and effective by the Centers for Disease Control until that was changed by Robert F. Kennedy Jr., the Secretary of Health and Human Services, just recently. The EPA limit of 4 parts per million of fluoride in the water, which was reaffirmed in 2017, is not related to community water fluoridation. This limit is set on, it refers to naturally occurring levels of fluoride in groundwater, such as the high levels of fluoride in the Ogallala aquifer. So to provide community water fluoridation in a situation like that, you actually have to take fluoride out of the water to bring it down to 0.7 parts per million. In a brief history of fluoridation, in 1924 in Oakley, Idaho, Dr. Frederick McKay found, well, he knew that stains were appearing in children's teeth after there was installation of a pipeline from a warm spring to a small town. Dr. McKay advised closing the pipeline, and in a few years, the stains stopped appearing on new teeth. So the stains that were already in the teeth did not go away. You can't wash them away. They're in layers of teeth. But they stopped appearing on new teeth. In 1931, in Bauxite, Arizona, which was an Alcoa town, Dr. McKay and Dr. Grover Kempf of the U.S. Public Health Service, they found that this same kind of staining, which we call mottling, is common there, but not in neighboring towns. And H.V. Churchill, who was the chief chemist at Alcoa, we know Alcoa for their manufacture of aluminum, he had the facility to do spectrophotometry of water samples where children have the mottling. And in those areas, he found high levels of fluorine in the water. In 1945, at the NIH, H. Trendley Dean, who was the director of the NIH, and Elias Elvov, who was one of their researchers, they found that 1 part per million of fluoride was able to reduce caries risk safely, and while still having a very low rate of this mottling of the enamel. And a lot of these stains, they just turn up as white flecks on the teeth and are, some people even kind of like that. In 1956, Grand Rapids, Michigan became the first city to provide fluoridation at 1 part per million. They reported that they had 60% less caries in their children after fluoridation than before. And in 2015, the U.S. Public Health Service recommended changing the recommended concentration of fluoride from a range of 0.7 parts per million to 1.2 parts per million to the single optimal level of 0.7 parts per million. And this was because at that time, they decided that it was easier to zero in on the exact range. So there have been questions of safety of community water fluoridation all along. But I love this op-ed piece by Dr. Katrine Wallace, which was published last year. And the citation, like I said, is in our list of citations at the end. I love this quote from her: "The dose makes the poison." And then she talks about how there are many other common examples of mineral fortification in the U.S. diet, such as iodine in salt, iron in flour, folic acid and B12 in breakfast cereals, calcium, iron, zinc, and selenium in dairy products. All of these minerals, including fluoride, have health benefits at the dose that's added while minimizing potential risks. Um, and according to the World Health Organization, well, some speakers and public health media pundits have mentioned that the World Health Organization cites fluoride as one of 10 chemicals of concern. But when you look at their list of 10 chemicals of concern, they list 9 of the chemicals, saying we're concerned about these chemicals. But for fluoride, they say they're concerned not only about excessive fluoride, but also about inadequate fluoride. Fluoride is a mineral that's a nutrient that we need to help keep our teeth strong. So what are the effects of hyperfluoridation, which is fluoridation well above the 7 parts per million, 4 parts per million or even higher? You can have dental fluorosis, the staining. You can have skeletal fluorosis. It's possible that there are neurologic and cognitive effects. We'll talk about the research on that in a little bit. What are not effects of hyperfluoridation? Cancer. There's no association with cancer. According to the American Cancer Society, which published a paper in 2022, the National Cancer Institute just recently published a paper saying no association between fluoridation and cancer, no association with osteoporosis. Back in 1996, there was a paper by Hillier et al. That showed a weak association, but I haven't found anything that shows a strong association. No significant effect on bone development in adolescence, according to a paper published in 2014, and no significant effect on osteoporosis in a paper from 2020. What about autism? It's inconclusive. Every study reviewed has some strong limitations, and we'll talk about that. What are the effects of hypofluoridation? So some people who are very concerned about having fluoride in their water have installed reverse osmosis filters. And reverse osmosis filtration is very effective. It removes everything, or just about everything, from the water. But you know what? It also removes calcium, magnesium, and fluoride from the water. People who use reverse osmosis filters suffer an increased risk of osteoporosis, according to this paper by VK et al. And by the way, this V, that's the last name. So increases risk of osteoporosis, stunted growth in children who drink water that's been through a reverse osmosis filter, reduction in calciferol or vitamin D by the kidneys due to lower calcium levels, and increased risk of tooth decay. Let's see, this is number 12.
This is,
Yeah.
yes.
Okay.
So, going back to that question of community water fluoridation and autism, when you're reviewing a study, it's really important to evaluate the following. Now, when they're discussing the autism, are there other confounding factors being included here? Other confounding factors that have been shown to have a possible effect on the development of autism, such as diet, age of the mother at child's birth, and things. There is some solid evidence behind, such as the environmental exposure to insecticides. Uh, Now, like my father just mentioned, the question of the concentration of fluoride is very significant, as many nutrients have negative effects at higher concentrations, but are necessary at recommended levels. You know, everyone needs to drink plenty of water a day to live a healthy, comfortable life. You drink way too much water, that's going to be fatal. Let's see, the socioeconomic status of the family of the child in question, and of course, the authorship of the study. For example, tooth decay prevention and neurodevelopmental disorder risk following childhood fluoride exposure, published in BMC Pediatrics, was authored by a de-licensed physician, Mark Geyer, and his son, David Geyer, who are known proponents of the discredited claim that vaccines cause autism. And after writing this, we found out that Robert Kennedy Jr. just named David Geyer to lead a team to discover the cause of autism by September of 2025. So, moving on to discuss the economics of water fluoridation. So, we looked at a systematic review published by Marino and Czar in 2020 that looked at 24 economic evaluations of community water fluoridation done since 1973. And among these evaluations, it was found that the community water fluoridation reduced incidence of caries from 25% to 40%. And as an example, we're going to take a closer look now at one study, Griffin, Jones, and Tamar from 2001. Before we can delve deeper into this study, we need to just briefly discuss what a cost-benefit analysis is. So this is the total costs of a project minus the value of the benefits. First, you create the framework of the project, list the goals and the metrics. Two, you need to determine the costs and the benefits. There's the direct costs, such as labor, materials, and then there's indirect costs, like the fixed costs for rent and utilities, intangible costs, like satisfaction, trust, and opportunity costs. What are the lost benefits of choosing one strategy over another strategy? And three, what are the benefits? There's the direct benefits. Usually that would be increased sales, but in the case of public health, we want lower cost of healthcare. Indirect, again, usually that would be increased interest of consumers, but in the case of public health, lower need for care, less pain and worry, better attendance at work and school, lower insurance cost, and lower utilization and cost of healthcare. And then the intangible benefits, like improved employee morale, but here, more intangible benefits would be the public has less pain and they feel better about themselves. And then the competitive benefits, areas with better public health interventions will perform better financially than areas without those interventions. Three, we must assign a value to each cost and each benefit. The direct costs, what does it cost to add the 0.7 parts per million fluoride to water per person? And the indirect and intangible costs, savings on healthcare, the value of work and school days that could be missed for dental care. And then we add up the costs and the benefits and compare the two of them. So this paper is looking at the value of disease averted, the value we get from avoiding cavities. And we calculate that by taking the caries increment of a non-fluoridated community and subtract that from a fluoridated community. and multiply that by the average lifetime cost to treat each carious surface, each tooth decay. So, a brief summary of the article. In 1995, the per person annual costs for community water fluoridation ranged from 46 cents to $3.44. And this range depends on factors such as population size. Now, currently, the cost in Massachusetts in 2024 ranged from $15.95 per citizen to $18.62. Now, the national estimates show that community water fluoridation results in a 25% reduction in tooth decay. That's a pretty significant chunk. And of course, that is controlled for other factors. Uh, Now, in 1995, the calculated lifetime cost of decayed surfaces was about $100.62. So, plugging this information into that little formula we just showed, the calculated cost of disease averted comes to about $8.97. And that is much more than the 1995 annual per person cost for community water fluoridation. Now, that's just the tangible cost. More intangible costs would be looking at productivity loss. So, to calculate the productivity losses, we would look at the average loss in work time due to a restorative dental visit, which that's an hour, more or less. And in 1995, the average wage was $18.12. And we included this cost for all individuals, regardless of age or work status. For individuals not earning an income outside of the home, this value reflects the opportunity cost of that decision to get the treatment done. And for children, this value reflects the sacrifice in caregiver time to take the child to the dentist. So, tallying all of this together, the total cost to society resulting from a decayed tooth surface was about $72. And this does not include time lost for other aspects of the care or time lost due to infirmity. Therefore, this is very much an underestimate.
So, what happens when you remove fluoride from a community that's had fluoride? This happened in Juneau, Alaska, not too long ago. So, in Juneau, Alaska, they did a study design. It was a pre-post analysis of Medicaid claims for 0 to 18-year-old patients. Now, it's not the best kind of study to look at this sort of issue, but it is a really good way to very rapidly analyze the experience of tens of thousands of people. What they found when they looked at these Medicaid claims, and remember, they're not individually examining patients, they're just looking at the bills that the dentist sent to Medicaid to treat children. There were a higher number of caries-related procedures after cessation of community water fluoridation. It was a higher cost per patient in the suboptimal fluoridation group of 28 to 111%. I'm not going to talk about the dollar amounts because we're talking about Medicaid dollar amounts, which are very different from if private insurance is paying, or very different than if you're paying out of pocket, but the percentages hold. The group with the highest caries experience and costs were born after the cessation of community water fluoridation, which indicates that if you were exposed to community water fluoridation, there was probably some benefit that carried over even after stopping community water fluoridation. And the limitations of this study are the retrospective pre-post study design, because as we all know, studies are more accurate if you're doing a prospective study where you start the study before having the intervention and then you study through the intervention. It relies on assumptions such as that all caries is treated within the year it's discovered, which is unlikely. Another community that ceased water fluoridation was Calgary in Alberta, Canada. So a study that was done about Calgary was, and this was done fairly recently, it was published in 2022. Calgary had water fluoridation, community water fluoridation from 1991 to 2011. In this study, they looked at children in the second grade by oral examination by trained and calibrated teams. They also used socioeconomic data from a survey completed by parents at the time. So in Calgary, they looked at children pre-cessation in 2009, 2010. In Edmonton, a similar city, also in Alberta, nearby, or relatively nearby. Distances are relative in Canada. They looked at soon after cessation in 2013, 2014, and then later post-cessation in 2018, 19. So what are the results? The odds of untreated decay is higher for the uninsured community in both Calgary and Edmonton. But the inequities were higher in Calgary, where fluoridation was ceased compared to Edmonton. So in Edmonton, even though children who did not have dental insurance were more likely to have cavities that were untreated than children who did have insurance, there was less of a difference in Edmonton than in Calgary. And there were some limitations. They only pre-examined children in Calgary, and they did not consider all of the possible confounding factors. I believe they were just relying on how similar Calgary and Edmonton are. Let's see, 21. Still my turn, right, Al?
Yes.
Okay. What happened in communities that stopped water fluoridation? And this is a systematic review by McLaren and Singal, and they looked at communities all over the world. Their question was, does cessation of community water fluoridation lead to an increase in tooth decay? Very simple question. They found 15 instances of cessation within 13 countries. And of the 9 studies that had at least moderate methodological quality, which is a technical determination of a study, 5 of them showed an increase in caries risk post-cessation and 3 did not. And this is a really interesting finding. It's a very interesting finding. Now, there were some limitations in this study. They only reviewed published studies. They did not look at gray literature, such as unpublished studies. They did not look at reports from health authorities. But the strengths were that they did a comprehensive search for publications and they included non-English studies. Now, what about those 3 communities that did not have an increased risk of caries? There it is. Note that in those 3 communities, in preparation for a cessation of community water fluoridation, they did some other interventions. They may have provided increased fluoride supplementation. So in other words, there were funds for parents or guardians to take children to the dentist or the physician and get a prescription for fluoride supplements, which we have available here in the United States. And also more funding for sealants. So children could go to the dentist and have plastic coatings put on their teeth to help prevent tooth decay. These are very effective interventions, but look how much more these interventions cost than community water fluoridation. Look how much extra work it is to have to take your child to the dentist, which hopefully everyone is doing anyway, and go to the pharmacy and pick up your prescription or have it mailed to you of fluoride supplements, or take your child to the dentist and have the dentist or the dental hygienist place sealants on all of the child's back teeth. Uh, these are great interventions. They're especially good for places where we do not have community water fluoridation, but where you do have community water fluoridation, there is a benefit to how easy that is. So, what about access to care? According to data from the 2023 Massachusetts Health Insurance Survey, and was published by the Center for Health Information Analysis in 2024, 14.2% of residents in Massachusetts reported any unmet need for dental care due to cost in the past 12 months. That's amazing. That is absolutely amazing. But only, and only 33.8% of residents of Massachusetts were uninsured at any time in the past 12 months. Also, I think that's kind of amazing. Um, I'm sorry, only 33.8% of residents uninsured at any time in the past 12 months reported a dental visit, as opposed to 78.4% of residents who were continuously insured. Um, I'm sorry that I said that way. I did that I made that same mistake last. Um, so only 33.8% of residents who are uninsured at any time in the past 12 months reported a dental visit, as opposed to 78.4% of residents who are continuously insured. So if you are insured, if you can afford to take yourself to the dentist, and you know how difficult it is to make an appointment and to keep an appointment at a dental office, imagine if if it's harder for you to be able to afford to pay for that. And we do have community health centers like the one that I work at in Peabody, Salem, and Gloucester. But remember, nearly all of the community health centers in Massachusetts are in the eastern third of the state. 57.7% of those at or below the federal poverty level report dental appointments, compared to 86% of those at or above 400% of the federal poverty level. And what about wait times? There isn't, I couldn't find any good publications on this, but I can tell you what the wait time is at North Shore Community Health Centers. We have wait lists for our dental practice that range from 3 to 5 months. It's actually more difficult to get in to see a dental hygienist than a dentist at this point. Allison, what's the bottom line?
Yes. So, in Massachusetts, according to the Department of Public Health Commissioner, for every dollar spent on community water fluoridation, we save $38. Loss of community water fluoridation is likely to result in higher levels of caries incidence. And this will affect those who are uninsured and residents of Massachusetts who live at or below the federal poverty line. Now, for residents who have Mass Health, our Medicaid, they will likely continue to have coverage, but they're going to find it increasingly difficult to make an appointment. And incidence of tooth pain and infection will increase for those who are not able to obtain care. And emergency room visits will then increase for those who are not able to access care in a dental practice due to affordability and availability. And I think it's very important to mention that it's really the most vulnerable of us that would be most affected by this, the children.
And This is our bibliography, which, as I said, is available to anyone who would like to have it. And I double checked all of these links over the weekend. They should all be fine. And I would really like to thank, first of all, Allison, thank you for presenting with me. And I would like to thank the people of the Public Health Museum, particularly Dr. Al Di Maria, for inviting us. And anyone listening, if you haven't visited the Public Health Museum, it is really an amazing museum with such interesting information. And Dr. Di Maria, I think that we are done.
Thank you, Dave. We have a few challenging questions in the chat. Um,
I I'm looking at that, and I don't know that I'm prepared to. Someone has really done their homework, and I don't know that I'm prepared to answer all of these questions, but uh, I see that there are very thorough comments and citations in the chat, and I endorse everyone to look at this. Um, I I don't know that we have time left to read all of this. Let's see.
what about the question about
Mhm,
uh, we've been using fluoride for a long time,
mhm.
and that you know maybe it only is a benefit for children that adults are receiving this fluoride dose, and that they're
That's an excellent question, Dr. Di Maria. Um, Allison, do you want to field that one, or would you like me to?
Um, yeah, so I mean, fluoride is beneficial for everyone. Of course, that consumption of fluoride can be more beneficial for the children whose adult teeth are still developing because then that fluoride gets made into part of the matrix of their enamel, making the enamel itself stronger and more resistant to the bacteria. Whereas for adults, we do, through just our day-to-day lives, experience loss of minerals from the surface of our teeth, just through what we eat, drink, any other habits we may have. And fluoride helps to kind of repatch those areas of our teeth and make them stronger and more resistant to decay.
Um, one thing, and I'd like to add on to that.
Yes.
Um, if you have a chronic illness that robs you of saliva, such as
Oh,
diabetes
yes.
and many autoimmune diseases, you benefit heavily from having additional fluoride in your system, whether it's by community water fluoridation or fluoride prescribed by your dentist. Higher, it's very very commonly I'll prescribe higher concentration fluoride toothpaste to adults, particularly when they have autoimmune diseases like Sjogren's, rheumatoid arthritis, scleroderma, uh, systemic lupus erythematosus, and and then again diabetes. And many of us take medications that decrease our salivation. There are over 425 medications that are commonly taken by people, even as simple as an antihistamine, that
Yes,
to
I've been
decrease the
seeing a
amount of
lot of increased dry mouth right now with all the pollen
yes.
from everyone taking their antihistamines.
So whether you're getting your fluoride from community water fluoridation, which is something that you don't have to think about, or whether you're getting it from a mouth rinse or a prescribed mouth rinse or fluoride toothpaste or fluoride tablets, then this is a huge benefit to adults.
so. question about how do we know how many, do we know how many people drink bottled water or filtered water in Massachusetts? So this is another potential confounding factor. And there are other confounding factors that have been brought up as sugar consumption over time and other exposures that may be affecting the various studies of.
Well, another confounder, Al, is that with bottled water, you don't know how much fluoride is in bottled water unless you call them. It's not labeled on the bottle. So, for example, back in the 90s, Poland spring water had zero point 0.6 parts per million of fluoride. Um, but now it's down to about zero point 0.1 parts per million. I believe it's because of how much water they're removing from the aquifer or from the spring. So Poland Spring, they actually do have a spring. They're able to remove a lot of water from it. Back in the 90s, zero point 0.6 parts per million of fluoride. And I know that because one of my patients was the Poland Spring rep for Eastern Massachusetts. And I just checked it, and now they're saying on their website that it's zero point 0.1 parts per million.
Okay, and I think you're right. I think people are welcome to look at all the postings on the chat. And as Dr. Leader said, you can get the slides if you want to review the sources that were used for this presentation and take all this information and come up with your own conclusions. And
Yeah. And by the way, Kay Spencer, I want to thank you for all of the additional material that you're adding in here. It's great to have information from both sides.
okay, I think if there are no more questions, we'll stop here and thank you
Okay.
very much.
Dr. DiMaria, I'll send you the slides, and if anyone asks you, you're welcome to share the slides with them. And anyone who gets my slides, you're welcome to use them in any way you like.
Thank you
Thank you
both
all.
very much
Thank
again.
you.
And this will be posted on the museum website. We do invite people to come to the museum and take a look at our website for coming events, particularly our summer program for high school students. If you know high school students, this year it's going to be a one-day event at the museum on September 27th with some follow-up presentations in the fall because um, we we recognized over the years that having a 1 week program in the middle of the summer wasn't ideal for a number of student attendees. So we're going to try a new approach to that. And thank you all for joining us this evening and good night.